Hello, Wake Up New Zealand, Carol Seekid speaking. I'm deeply concerned about euthanasia laws and what's happening around the world. We have Canada next May actually legalising euthanasia for mental health conditions, mental health illnesses. So legally introducing them a premature death for mental health issues with no terminal illness. So this is an extremely slippery slope that the rest of the world, many countries are going down, the advocating of regulations of euthanasia, making it much easier for individuals to access euthanasia, where David Seymour wants to amend the euthanasia law, end of life choice, and make it much more relaxed. Come next year, he will be able to amend the Act, and it's also been reported within mainstream news that he tends to do that, to relax what is now has included in the criteria for 6 months term of life that is left, the terminology, to be removed to include mental health. Just the same road as Canada has gone down. So that's just after a year of this act being legislated. We have 214 assisted deaths of individuals that have accessed the Euthanasia Act. So euthanasia, there are the David Seymour Act. There are very dangerous concepts there, the safeguards there. And the safeguards are not being fully taken care of, and we don't publish this. We do not talk about it. It seems to have just died a natural death that we don't question David Seymour's Assisted Suicide Act anymore. So, yeah, I personally believe that David Seymour is a euthanasia activist. As reported in mainstream news, that the Euthanasia Act being passed into legislation, Seymour proposing an amendment to his act, calling for relaxing the Euthanasia Act for people without terminal illness to have the opportunity to seek assisted death with mental illness, as they've done in Canada, hence removing the criteria requirement of terminal illness. So Seymour has admitted he only agreed to the 6 months limitation for terminal illness to get the bill through Parliament. So his original bill would have allowed non-terminal patients with grievous and irremediable conditions to have access to the lethal end-of-life drug. It's been reported by media that Seymour agreed to limit the term to 6 months terminal illness to end of life to get the bill through Parliament. And he's actually admitted that. So some felt that Seymour's original euthanasia bill was much too broad, raised concerns about assisted dying would mean that would be available to mental health patients. If Seymour follows through with his amendment proposal, this is what will happen. He is already speaking about euthanasia being available to mental health patients. So Canada's slippery slope, 2016, 1,000 people approximately accessed assisted dying. But in 2021, it's 10,664 people accessed assisted dying. With more people dying from euthanasia legislation than from diabetes, pneumonia, influenza, liver disease, etc. Reuters news agency reports how a 47-year-old Canadian lady actually was seeking access to euthanasia because she was suffering from anorexia. Because if you think about mental health, it's huge covers many, many areas. It's massive. So I am talking about dehumanizing human life itself, and David Seymour revisiting his original euthanasia bill, where the terminology for termination of life for 6 months will be removed and will not include terminal illness for mental health, just mental health itself, the psychological suffering that is intolerable to the individual. So medical ethics, firstly, do no harm. However, Canada is allowing for assisted suicide for psychiatric patients with psychiatric disorders. Several countries have been allowed this since 2002, Belgium, Netherlands, Luxembourg. They are collectively known as the Benelux nations. And the Benelux nations have permitted assisted suicide, euthanasia, for physical or psychological suffering that cannot be treated by acceptable terms. It's documented that between 100 and 200 psychiatric patients are euthanized by open request annually between Belgium and the Netherlands. So, euthanasia beyond medical conditions for those who are tired of living. Pegasus, a self-proclaimed voluntary assisted dying association that's based in Switzerland, currently provides euthanasia for non-medical suicide tourists. A well-known disability advocacy community in Canada have reported to be extremely concerned that permitting euthanasia for non-terminal disabled individuals may not have adequate access to the state-of-the-art of treatment. What they're saying is the treatment is not there available. No adequate treatment is available for mental health issues, mental health patients. And they talk about mental health conditions caused by the cost of living. And they say, well, the lethal jab for a solution as an alternative to suffering for what they cannot be provided with, these solutions to their mental health conditions. So not affordable and not adequately available to them. So the following justifications are being applied for access to premature end-of-life assisted death euthanasia for mental health, psychiatric disorders, for example, autonomy, self-determination, intolerable suffering, which is irremediable. So New Zealand Herald reported on the 7th of November 2022, euthanasia laws too strict, should be relaxed, says ACT leader David Seymour, removing the criteria requirement that a patient has only 6 months to live. You see, following Canada, some groups felt that the definition was too broad back in when he first introduced this. He'd been working at this for years and raised concerns about this removing of the terminology of terminating life up to 6 months. But the amended law was passed through Parliament because he then amended what the original bill he had and put in that terminology, life up to 6 months. But now he's going back on that and he's saying he wants to go back to the original and take that out to amend it for mental health for euthanasia. So the New Zealand Herald article referred to the definition used by the World Health Organization as being confusing and could easily be interchanged when it comes to the criteria of access to assisted suicide, assisted death, assisted dying. So it could be interchangeable, used in different ways. So the slippery road to dehumanizing human life. So death has become the treatment, just another marketplace transaction. Serious mental health, not in a clear decision-making ability to actually choose whether you want to die by assisted death. How can you, if you have a mental health condition, actually make a clear decision yourself around assisted dying? So that's my personal question. How can that happen? Is it that mental health worldwide is in such disarray and is failing worldwide that they've sought this as a solution to mental health rather than a caring early intervention, which has failed many countries. So governments that have failed people with mental health conditions. So we're looking at individuals' natural death is reasonably foreseeable, lives that are not worth living, a narrow medical mental health solution to a much larger social problem. So where is society's obligations in supporting the positive enabling of the sick and the dying, the autonomy, the enhancing of life, the social support? New Zealand Mental Health Failings, 29th of May 2023, RNZ Report. A teen tells of a lack of mental health support despite abuse by state care. New Zealand mental health facing another crisis. New Zealand Herald, 28th of May 2023, 9th of June 2023. New Zealand's health is broken, is failed. So where is the compassion, the care and prevention, the early intervention focus? What now? Lethal jabs as the solution? New Zealand failed mental health support? Spilling over to people feeling powerless to be able to access adequate support, adequate mental health care? Is this the bottom of the cliff? The ambulance at the bottom of the cliff? Is this what it's about? A lethal injection to end life prematurely because of mental health failure in New Zealand? Because it sure looks like it. So, people, I am seriously concerned about this. And we do need to talk about it publicly. And I intend to stay on this road talking about this publicly because David Seymour will be going down this road. Wake up, New Zealand.